so much. No, I want to keep it here. Okay, shimmy back. Thank you. Okay, so lateral, it's not going to work the same because you have no comparison. So a deep breath doesn't tell you as much, but a squish, so squish on one hand, squish on the other hand. Squish here. Now I can't really squish here because of the arm, okay? I can change position. So, okay, she wants to do this. Why don't I want to do this and push here? Ouch, where? Elbow. So, there. And your elbow just cracked. I don't know why. Right? So I can push here. It's a blunt sense. I can push here. It's a blunt sense. I can push here. Okay? I expect less general movement the higher up you go because the ribs are smaller, the angles are different. But would you agree, at least in this position, here-ish? Okay? So, look. Wiggle squishy. Squishy, squishy. Not so much squishy, right? Like it's not going to move as much, but as long as the shoulder's not doing, as long as I'm not doing this, wow, look at how much they squish. Look at those ribs, right? That's why you look. Because my hands moved a bunch, but the ribs didn't do a damn thing. Okay, so you got here. Anyways, I could just be here. I can put a hand on the back and pay attention to the area, and I can add, right? So I can do this, or I can get in nice and tight, squish here, push here. Is that close to a smile? Mm-hmm. Okay. Right, so that's an option. This is just about the same thing, but I can't see as well now. So I can't see if she's smiling or grimacing. I can't see it. Now I can, but it's kind of weird, right? Okay, but I got rotation. I've got PA, which is relative extension, and I've got lateral to medial movements here. So whether I'm standing or not. Now the thing that I do want to note is that osteopathy has a history of rib raising off of the arm. The challenge that I have with that is that raise your arm over your head. Her shirt went somewhere, but her ribs really didn't necessarily do a ton. They did something. Come back, right? Keep your arm right there. Take a deep breath. That's ribs moving. Okay? So I need something to approximate that. When we're doing rib raising off the arm, utilizing connections from the humerus to the anterior ribs in the pecs, the major and minor, as well as serratus anterior, and just general soft tissue connection, we're going to feel tissue tug in the intercostal spaces, but we may not be getting rib movement. We may be better addressing the relationship between the scapula and the thorax and the humerus and the scapula and the thorax. Like that might be what we're doing and why it seems to do something, but it's just a little bit less accurate. Now, the thing that you don't benefit from is this, okay? Because I can't get over here if I need to, and I don't have much of that if I need to. This is going to be better, okay? So more contact on, or holding on the forearm. I need to find an intercostal space that I'm interested in, and that's the same one, isn't it? When you were seated, okay? So now I need to target it. So the idea is that, okay, so you see some separation and some movement above it. So that actually seems to be connecting pretty well, but I need to know if this connects better, right? That's probably better, you agree? Okay, so movement's happening there, stuff's happening there. In this case, it's working better than I would have hoped. But in some people, this doesn't work as well. But you've got to be in the intercostal space. So if my hand's here, am I in the intercostal space? I'm kind of nowhere. I can feel movement, but I'm kind of nowhere. I can do this and be in intercostal space, because now it's a straight line. If my hand will let me, I can do this. So I can use the index finger or I can combine the fingers. There are other ways to do it that are a little bit more blunt, but generally speaking, this is probably good. And this is probably good if I can actually get in there and it doesn't mess my hand up too much. But there. Right? And at least in this case, I think we can all buy that there's a lot of movement happening above it. It doesn't mean the ribs are separating, but it's connecting well to where I'm aiming. Right? So maybe it's the ribs, maybe it's not, maybe it's everything. But that is what you'll see. And then they'll just kind of work up and down as far as they can in the mid-axillary line. So once you start to get into the armpit, it's more sensitive, it's more tickly. It doesn't work as good, right? But generally, in a broad sense, you can get a lot of leverage by using the shoulder girdle to move the torso, interact with where you're aiming, right? So when I did the seated one, and even the supine one, and I use the shoulder girdle to push in whatever way works, you can see how it's the same general pattern, but just in a different position.
Would you ever take from like the front when you're sideline, or no? Just
no. If I was standing in front of you and I was holding your arm and raising, would it look a little weird to you?
Yeah.
Now, it doesn't mean it is weird.
No.
It's a concern of mine, so I generally avoid it. The other deal is that I have a harder time seeing it because my angle is different, whereas this, I'm right there. And I don't have to reach. So when I'm
not moving the arm. That's what I'm saying. Like if you're just like assessing from the front, like
because I can't see the ribs.
Yeah.
I prefer not to, right? So if I'm in front, shimmy forwards a bit, right? Like I can see it, sort of, but it's somewhat obscure to me, right? So you will see stuff like this, right? Now something's definitely happening to the ribs. But am I clear on what it is, right? So if I pull here, now what's the other deal? What have I had to do in relation to the table? Right? My hamstrings aren't on fire because I'm smart enough to bend my knees. But here, it's okay. Yes, your described vision, or your described what? Described video. Yeah. So look, all of that, I can get in here and I can do that. I can do that, but it's just not as clean. I can, listen, you're definitely going to see stuff like this somewhere, right? But the rib's just moving. It's not connecting well, right? Now, if I'm here, bring the arm up to the side, more or less, right? Now, I can work on it pretty well by feel, but I'm missing some information. So it's possible to do by all means. It's just more confusing. Right? And you agree that the other ones got it.
Yes.
Right. So what I said
better
was
connection.
Better connection because there's better control because I can see it. And there's certain positions even in the same relationship. So like I'm still posterior, but there's better.
What?
The smile.
Yeah,
but
smile.
You are, but it seems sly. Whatever, man.
Look at me.
Don't look at me. Anyways, there's better, say, arrangements whereby where I am, if I'm standing, it works better versus in the same, I'm behind the patient's on their side. If I'm sitting, sometimes it works okay. Sometimes it's standing. You've got to figure that out by trying it. But yeah, some just connect better. Yeah. Right. Whatever.
You made it worse.
Yeah. You made it worse at the same time. Anyways, okay. Yes, I do. And I might put it on YouTube. Jeez. Whatever. It's words. You guys are so judgmental. Shut on up. So much judgment. Anyways, okay.